Hello guys, welcome back to my channel. I'm Lauren Drain. I am a registered nurse and a fitness enthusiast, and I've been doing a bunch of updates on my pregnancy. I'm a first-time mom, I'm 32 weeks pregnant, and I have some news during this pregnancy. So this video is going to be about cholestasis of pregnancy. If you haven't heard of it before, I'm going to give you all the details that I found out about it and just give you kind of a breakdown on this topic. How did this start? I've been feeling really itchy, and it's been progressing over weeks and weeks, and I feel itchy all over. No rash, no visible issue on my skin, but I'm just having this crazy itch that cannot be cured. I itch on my face, my eyes, my nose, my ears, my lips, like the weirdest of spots, my elbows, the bottoms of my feet, the palms of my hands. And at first, this is my first pregnancy, so I wasn't thinking like, okay, maybe I'm just itchy because of my hormones, or because my skin's stretching, or because I'm gaining weight, more increased blood flow, something like that. And I just realized the itchiness is getting out of control. It can't, like I said, it can't be cured by Benadryl, antihistamines, cortisone, aloe, lotions, oils, calamine lotion, oatmeal baths. There's nothing that makes this itchiness go away. In fact, I only feel flare-ups that go up and then down and then up again. And over the course of days and weeks, it's been getting progressively itchier and worse, and to the point that you basically itch your skin off, and there's no remedy. And so I decided to start doing some research, and I was looking up online, and I discovered that there's this thing in pregnancy called cholestasis of pregnancy, a condition that some women can develop during pregnancy where their liver is unable to clear out the bile salts in their blood. It starts to build up toxicity of bile acids in the blood, which then the body's trying to excrete, and it goes onto your skin, and it causes this itchiness of the skin. The problem with this condition is that these bile salts that are not getting cleaned out of the blood are flowing in through the placenta to the baby as well. So the baby is getting the toxic effects of the increased bile acids, which is very dangerous for baby, because this could build up a toxicity to the point that the baby's heart could develop arrhythmias, the baby's heart could stop. It could lead to fetal demise. It could lead to respiratory distress in the baby, and even stillbirth. So it's a very serious condition, and unfortunately a lot of women might not know about it. I didn't know about it. I'm a nurse and first-time mom. I didn't know anything about it, and then a lot of doctors don't check for it. They're not regularly checking your bile salts, your liver function tests, and things like that to see if there's something wrong with your liver during pregnancy. So oftentimes what happens is the patient has to complain to the doctor saying, I'm having this crazy itchiness, and actually find it concerning and let the doctor know. By the time you let the doctor know, your bile acid levels could be extremely high and toxic, and it may even be affecting the baby at that point. So I immediately, when I found this out, I was doing some research. I called my OBGYN, I came in, I got my blood tested for it, so I'm waiting still on those results. My LFTs need to come back, my liver function tests, and my bile acids. If the bile acids are higher than 10, I think that's what they say is a positive diagnosis for cholestasis, which is when the liver can't clean out the blood of the bile acids, and you're constantly, every single day, every single week, building up more toxicity. So the doctors can put you on a medication. I think it's Ursodiol, and it's supposed to help with that, bind to the bile salts and help them excrete. But I think the toxicity is still there, and the baby's still at danger for it. So each day and week as you progress in your pregnancy, your baby is still at risk. And there's no real way to prevent the baby getting exposed to this. And so the treatment is to monitor baby's fetal kick counts to make sure the baby's still moving, to make sure the baby's heart rate's still there with a fetal Doppler or a nonstress test of the heart of the baby. and to induce early. I guess the rate of stillborn goes up after week 37 of pregnancy. So the reason they decide to induce at 37 weeks is because by then the baby's organs, their lungs, all of their organs are fully developed, so they could be able to survive being born early at a late preterm or early full term. So usually around 36 or 37 weeks, the baby is healthy enough to survive in the outside and can be delivered safely. But if they stay inside to full term, 39 to 40 weeks, their risk of developing fetal demise or stillbirth or go up increasingly each week. So it's very scary. And the other issue with it is that, you know, you can have these symptoms like the itchiness all over your body, and your bile acids might not show it right away the first time you get checked. But if it continues and you do get it checked, your numbers can spike up really, really high later. So you could be at like less than a 10, and then like the next week or even a couple days later, you could be at like a 40 or a 50 or 100 or 300. So the toxicity can build up very fast. You're not going to know about it because the chief symptom is really just the itchiness. And if you're thinking that, you know, a lot of women might think, you know, as a first-time mom, I didn't know if itchiness is normal or not being pregnant. And some people tell you, you know, your skin is stretching, your body, you're gaining weight, you're gaining fluid, you're getting swollen, all these things are happening to you, you know. The itchiness is not a big deal. Just make sure you lotion up and you put all these different lotions and oils on and stay hydrated. So the reason I made this video is because it's concerning that this only symptom, the only thing you're gonna know is the itching, and that you should prompt your doctor to let them know that the itchiness is bothering you. Because I've been going weeks and weeks now with these symptoms thinking that like, okay, I'm just overreacting, I'm super itchy, I'm probably just uncomfortable or overanalyzing it or thinking about it. And I haven't exactly stated to my doctor at every single appointment, is there something concerning with being itchy? You know, the first time I think I mentioned it in passing, like, oh, I'm feeling backaches and I'm feeling swollen and I'm feeling tired and I have some itchiness. And then my doctor was just like, oh yeah, those are all normal symptoms. And so we didn't look into it. We didn't get my blood levels checked. And so there's no way of knowing if I've built up a really high toxicity even back then or even now. So because it's such an issue in terms of the baby's health and making sure the baby's heart is safe, this is the reason I made this video. So I wanted women to know that if you're having this strange symptom, please get checked out. Please get your bile acids checked. Please get your liver functions checked to ensure your safety of your baby. And even if you get them checked and they're normal, get them checked again the next week. If the itching persists, there's something wrong with you, going on with your body. There's something not normal, especially if there's no rash, especially if antihistamines, Benadryl is not helping. It's obviously not allergic at that point. It's obviously not, you know, if you've done everything to try and process elimination and find out what this itching is from and it keeps continuing, something is going on with your body, you know, metabolically or otherwise, that's trying to signal to you that something might be wrong. And it might seem very benign, like, oh, I itch, like what's a big deal? But you can see why that's pretty scary. So people have lost their babies due to this, not knowing, or having gone their whole pregnancy without getting their levels checked, having a stillborn and not knowing why. Everything else looks and appears healthy. The baby's moving, the baby's heart is normal, your vitals are fine. Everything else seems stable except for this itching sensation, the progressiveness of it, and not getting relief. So I wanted to make this video for anyone. I'm going to keep you guys posted. I am waiting for my test results. Bile acids sometimes can take a lot longer to be resulted. Liver function tests, I think, coming back in a couple days, depending on your labs. But sometimes the bile acids have to be shipped over to like a different lab, a specialty lab, so it could take like a week or longer. You know, I read on some support forums that are talking about this. It's called intrahepatic cholestasis of pregnancy. ICP is another thing that people call it. Cholestasis of pregnancy are the names of it. And there are some support groups out there if you have any questions. I actually found one on Facebook, has like 13,000 members of very active women posting every day about their levels, about their symptoms, about their babies that have done really well. almost everyone is recommended, once they're diagnosed or once they realize they have it, they're recommended by their physician, by their OBGYN, to get induced at 37 weeks or earlier, because the risk to the toxicity of the baby is just way too high, you know, and once the baby's affected by the toxicity, there's no remedy. The baby will not survive. So there's no way of knowing when you're carrying a baby if the baby's okay. You know, as soon as you notice that there's no kicks or no movement, by that time it's already too late. As soon as you go and get checked and there's no more heartbeat, there's no way to reverse that. So that's why this is such a serious condition. It's something that needs to be attended to. It needs to be taken seriously. It needs to be looked into. And even if you're suffering from normal itchiness, that's not a problem, and you don't have toxicity, thank God, that's amazing. But it's better off for your own safety and the baby's to know that you are okay. And the other thing I will point out is that when I did some more research on this, even perinatal physicians were saying that you can have these symptoms of itchiness without having a positive bile acid test, and it can actually show up a week or two later or up to 4 weeks later. So some women are feeling and noticing the itchiness sooner than others, and some of them are not noticing it until it really creeps up and gets so bad that they're itching literally their skin off, to the point that they're bleeding, they're scabbing, they're having full-blown like hives that they created from itching, and even to the point that they can't sleep through the night. Nothing remedies. So sometimes women wait until it gets that bad. So like I said, I try to make this video informative as much as I know. I'll keep you guys posted on what's going on with my pregnancy. I'm almost positive that I have it. These symptoms are very hard to ignore, and even if I don't have it, which hopefully I don't, I'm going to continue to get tested every single week to make sure that it's not the case, that it's not slowly creeping up in my blood, and just for peace of mind as well. But I also am going to have to find out why would I be itching this much? Like, it's a very strange progressive symptom that I feel like my body's telling me something's wrong. So yeah. All right guys, well I hope I give you a lot of information on this video. I'll actually be doing I did a lot of updates earlier about like when I first got pregnant, the first trimester, the second trimester, and I'll probably go over some things about my third trimester in the next video on things that I think are maybe must-haves during pregnancy, things you might want to know, things you might want to have during your pregnancy to get through your third trimester, because there's a lot of symptoms other than that are, you know, difficult to deal with. So stay tuned. I hope you like this video. Please give it a thumbs up. Please comment any information you have or experiences you have below if you know about this, and I hope this reached somebody that I could help. I think it's a very underdiagnosed condition, but it has very serious consequences, so I really hope this can reach people and help people and save a life or save some babies, and also help mothers advocate for their babies. So okay, so I just wanted to mention some of the treatments. Obviously the Ursodiol, which is a medication supposed to help with the bile salts and the itchiness, but like I said, it doesn't prevent toxicity to the baby, so it's still an issue. What they do end up doing is check the baby's fetal kick counts, and also their heart a couple times a week, and maybe do a non-stress test on the baby's heart to see if the baby is having any arrhythmias or any issues there. Like I said, the only issue with those treatments are they aren't preventative. They don't prevent issues. They're not going to be able to tell the mother if she's going to have any issues the rest of the week or in a few days. You know, all it really says is in the baby's current position, they're not having arrhythmias, their heart hasn't stopped, etc. But it doesn't prevent that from happening 6 hours later, a day later, 2 days later. So as much as it's helpful that you're getting closer monitoring during your pregnancy, I don't know that it would alleviate my anxiety about the safety of my baby. So the things that I've been doing for myself are also reducing my risk of my bile salts going up. So I've actually put myself on a diet that's supposed to be the best for cholestasis. So I'm reducing the foods that could increase my bile salts. So I'm basically eating a lot less saturated fats. I'm eating no processed meats at all, no processed delis, nothing like that, nothing like a hot dog or a sausage or anything like that. If I'm having protein at all, it's only organic, whole foods that are just like straight up meat, like a chicken breast, something that's leaner, not have animal saturated fat in it. I'm having fruits and vegetables, organic, to remove all the toxins, pesticides, everything out of it, to make sure it's as clean as possible. I'm not having, sorry, I am not having any dairy, so I'm removing all the dairy and things from my diet. I will have like almond milk, cashew milk, things like that are okay and safe. I'm not having white breads, white pastas, or any basically bleached and processed breads. I'm having like strictly just sprouted grains, whole foods, healthy complex carbs, and I'm avoiding sugar, like cane sugar, corn syrup, things like that. I am eating, instead you can have honey, like raw honey and raw maple syrup, and like dates and fruits and things like that are okay and healthy. So you're basically avoiding anything that has high saturated fats in it, unhealthy fats, animal fats, things like that. I guess it's okay to have like nuts and avocados, nut butters, olive oils, coconut oils. Those things are safe because they're monounsaturated fats and they're supposed to be healthier, easier for your body to digest and break down. I'm itchy everywhere already. So yeah, I've been trying to reduce my risk of increasing the toxicity through my diet, drinking lots of water, 12 glasses a day with like lemon in it. Lemon helps with the detox the liver, so I'm doing that every day. I'm also taking some vitamins. So I read up that actually omega-3s are really good, so fish oil. Activated charcoal can also help. If you take that with your meal, it can prevent absorbing certain toxic things in your diet, so that can be good. Turmeric is good for anti-inflammatory, and apple cider vinegar I was also told is really good for cleaning out the liver, detoxing. I order 2 things in the meal on the way that I order from Amazon. I have dandelion root tea. You could take dandelion root capsules also. Oh, milk thistle, which is good for detoxing the liver. The other thing I can do is check on my baby. So I check her anytime I'm worried or concerned. I lay down and I check and I feel and see if she's moving. That makes me instantly feel better. I also had already previously purchased Angel Sounds. This is just one of many types of fetal monitors that checks the heart. So it comes with headphones. You can hear, it's like a Doppler, fetal Doppler. So you just put this right on the area. You use the ultrasound gel and you can hear the baby. Their heartbeat. So anytime I'm worried or concerned if the baby's not moving, I instantly will check, and it's just a great way to be able to monitor myself on a daily basis if I need to, if I'm worried or concerned, because obviously getting checked by the doctor only once or twice a week is not necessarily going to alleviate any mother's fears. So those are the things I'm doing, guys. Like I said, I'll keep you guys posted on my results, and like I said, I hope this video reaches somebody, helps a woman who's distressed about her itching or cholestasis or pregnancy, or just to be informed or to inform someone you know, even if you're not pregnant. It's just good to be prepared and to be cleared of these things. So thank you guys so much for watching. I hope you like this video. Comment below any questions or comments you have about this, and I'll get back to you guys with results as soon as my results come back in from the doctor. So thank you guys.